welcome everybody to our YouTube channel. Kelsey and I are so excited. We're going to do a little bit of an intro video, and you'll have to excuse my good friend here, Kelsey. She's a little bit sick. She's lost her voice, so I'll probably be doing most of the talking just for all of our sakes. But why don't you go ahead, Kelsey, and tell us a little bit about your nursing background, what brought you here?
Yeah, awesome. So obviously I'm hoping this isn't a sign that I'm cursed for the podcast world, but I woke up this morning with no voice, so forgive me. My name's Kelsey. I'm a nurse practitioner. I'm originally from Thunder Bay, Ontario, and moved here more recently, which is where I met Michele. I worked as an RN in the hospital in neurosurgery, and then worked in public health for years. Once I graduated from my MP, I worked in primary care for about the last 6 years, and then really developed a love and interest in injectables, and that's kind of what brought me here.
And I'm Michele. I was born and raised here in Edmonton, which is where Kelsey and I now work and where we met. We're here at Rejuviderm in our flagship location. And even though I was born and raised here, I've actually done some nursing in the States. I lived in the States for about 5 or 6 years, following my husband's career there for a while. And my background in nursing is surgical nursing. I'm a wound ostomy continence nurse. And then, I just got sucked into the injectable world, the cosmetic world. It's extremely challenging in a very beautiful way. It's very much a blend of arts and science, and I love that about it. Yeah.
I agree. So in this segment, we're going to cover a little bit about what we've been up to the last week, any exciting things we've done personally or professionally. So I'll let Michele kind of take over here.
I know, I'm very curious as to what you've been up to this week with a voice like that, but
recovering.
Another time.
It's been a busy summer.
Actually, this week we were able to attend a MRSA dinner, which in this industry, if you don't know, we do a lot of educational events, and in order to kind of make them a little bit more appealing to attend to, usually the companies will set you up with a nice dinner, you go to a nice restaurant, you get some good alcohol, which Kelsey and I never partake in. But this week, the company was MRSA, and they carry a soft filler line, soft tissue filler line, Bellatero. They also have a neuromodulator, which is Xeomin, and then they have a biostimulator, which is Radiesse, and that's what this talk was about Radiesse.
Yeah, so the topic kind of focused on Radiesse, but also the approach of regenerative aesthetics, which Michele and I are very much into. So it's more prevention, but also restoring some properties that we naturally lose with aging. Focus on collagen, elastin, fibrin production, restoring structure, volume, but also focusing on the quality and texture of your skin to, promote natural results over the years that kind of give you ongoing benefit. So it's not just like a one and done treatment. So that's something that we're both very interested in, and something we'll focus on more in depth in a topic in one of our podcasts to come.
Yeah, it's essentially the idea of treating what the issue is rather than just covering it with a Band-Aid, which in medicine is something that we try to do all the time. There's a place for when we just want to add a little bit of, put the Band-Aid on and just do a little symptom control, but it's much better to really treat the reason why we're aging, and to be able to be a little bit more corrective and regenerative. So like Kelsey said, this is a topic we are extremely passionate about, and really, it's the idea that guides both of our practices. We really believe in natural results, and the best way to do that is with regeneration. So this is something we will definitely be covering later on. And if you have any questions about it, or if you really have any comments about it, or anything that works really well in your practice to help with regeneration, we'd love to hear about it. Something really exciting that we are going to cover today is hand filler. I'm not sure how many of you as practitioners out there offer this service. It's something that as a clinical educator, I get asked to train on a lot, because a lot of people are afraid of this area. How did you feel about hand filler when you first got into injecting?
For sure. I think because the area is so small, and the skin can be so thin, especially as we age. It can be a little bit intimidating as an injector to get into this area, but the results are really beautiful. And because this area gets so much sun exposure, damage over the years.
How many times do people come in and, and you hear this in the public a lot, is that hands give away your age. Because people can come and they'll do treatments on their face, and it's the same kind of idea for the neck as well. It's an area that goes untreated often and can be a really big giveaway for the age of your skin if it goes untreated. So it's something that we can do a lot of prevention in, and it really just helps to add a little bit of youth back.
Exactly. And like Michelle said, there are ways to prevent that aging that we can start at a younger age as well. So like I said, it is a common area for exposure to all these factors that, increase the aging process or speed up the aging process. So things like wearing SPF on your hands. You can also use topical retinoids on your hands over the years to help with fine lines, wrinkles, and maintain the quality and texture of the skin on your hands.
And really a lot of even laser treatments, chemical peels, things like that, things that you can do on your face and your neck, usually you can actually extend for the most part onto your hands as well. So it's something to ask the next time that you're in getting, any service, if maybe it can benefit into areas like your hands or your lower neck or your chest.
Exactly.
Yeah.
It's one of the neglected areas for sure, but like Michelle said, it really does show the age of an individual, and there are ways that we can treat it, and one of these ways is with filler to restore a little bit of that volume and improve the appearance of the fine lines and wrinkles.
Here you can see Kelsey injecting the hand filler. She's using one entry point and gliding the cannula into the subcutaneous plane. We will discuss the procedure at length, and then we will replay the video so you can watch it with the new applied knowledge. Let's talk first about entry point. Why did you choose to go into the knuckles?
So that's an area that you can enter from, but you can also enter from a little bit further down the hand, closer to the wrist. Sorry, again, Michelle will take a lot of this episode. But it is a little bit of an easier entry point and a little bit more comfortable for the patient as well.
Yeah, I find that when you're facing the patient, so if I'm injecting Kelsey's hands here, that it's really easy for me to enter from here rather than trying to have to sneak around and enter from this area. So it's we want to make it easy also on the injector because it'll go a little bit smoother.
Yeah, for sure. And like Michelle said, if you're holding the patient's hand and you actually can bend their fingers, it almost improves any issues with the laxity, which sometimes can make it difficult to find an entry point. So it kind of creates a little bit more tightening of the skin to allow an easier access point for the cannula, which is the technique we use in the hand.
Yeah, so let's talk a little bit about the cannula over needle. I find that a cannula it's just much easier to find the plane that you want to get into. It's a little bit more comfortable, and it causes a little bit less trauma to the outer skin, especially because the hands are so thin. So we're trying to aim for that subcutaneous layer. And so the cannula, you can easily find it, you can easily guide it through. You can use a needle, absolutely. I would suggest if you use a needle that you pick up a little bit on the skin and you can enter into the skin, into the subcutaneous layer with the needle a little bit easier that way.
And if you think about the volume or the area you're covering with the cannula with one poke or entry point, it's much more tolerable for the patient. So you can cover most of the hand with just one entry point, whereas with a needle, there's obviously more pokes for the patient. So more side effects, bruising, swelling, things like that as well.
Yeah. Can we talk a little bit about vascularity in this area? What about safety with injecting with a cannula?
For sure. So obviously cannula is a little bit safer of a technique, although there are still risks with a cannula. So for those of you that don't know, a cannula is like a longer blunt tip needle that we use to inject. So it doesn't have the same risk as the pointiness of a needle to occlude or puncture a vessel. But like Michelle said, we aim for a certain plane in the hand, and the reason is so that we avoid the vasculature level of the hand. So by ensuring when you can see that you're in that level, it's much less of a risk of hitting any of those vessels in the hand.
Yeah. Product amount. How much do you gauge to use per hand? Relatively, because we know that all patients are a little different,
Yes.
but we kind of have some baselines that we can work on.
Yeah, for sure. So obviously, like she said, every patient is an individual, and we have to assess them as that. However, there are some kind of baselines. Usually, I'll start focusing on probably about 1 syringe per hand, depending on the age of the patient. The patient that we actually did in the video is much younger, so we ended up doing 1 syringe for both hands total. And we did dilute it as well, so we mixed it with saline. That kind of softens the product, but also gives you a little bit more volume to inject into the hands.
Amazing. So when we're thinking about product type that we want to use in the hands, a few things that come to my mind is we want it to be extremely hydrating. It's one of those areas that we want to really mimic that layer of that soft fat that we have in our hands, and that's what we want the filler to mimic. So we want to pick a filler that will be nice and soft, draw in a lot of water. And in this particular case, you blended it with saline. Correct? Yeah. And so product types that I use in the hands and that you use, we can, we'll mention one for each brand. In this video, you're using
Silk.
Yes, Silk from Restylane.
Yeah.
Yeah, which is a really beautiful soft product, and it's also very moldable, which is nice.
Yes.
You can use Volbella from Juvederm. You can use Balance from Vallatero, and I would say you could probably use you can use Ultra, absolutely Ultra, or Versa in the States from Revanesse in the hands. That's a really beautiful, versatile product as well.
Yeah. And like Michelle said, we want something that is going to be quite moldable. You can see a little bit in the video, but we are doing like more linear threading and with fanning in the hands. And so initially when you're injecting, you can see almost like a little bulge of product, but that can be easily blended into the tissue. So we don't want something that's really, really firm or with a high G prime that we're not going to be able to do that with.
Yeah. And is that why you blended the product?
Yes.
Yeah. Yeah, it's amazing. So I find too a few different techniques in this video. Kelsey's fanning the product in, which is a great way to work. Pain-wise, when you are using the cannula and you're going over different layers, because the hand can be a little bit bony and has some connective tissue in it. So we have to be a little bit careful with that, and it can be painful if you go into some layers. For most of it, it's essentially, I would say 90% of it is painless. You almost don't feel it. And then there are those spicy moments. So the less strokes you do, the more comfortable it is going to be for your patient. So there are some people that actually just do a large bolus of product. They go into the cannula, they do a large bolus, and then if I take Kelsey's hand here, if I have a large bolus here, what you can do is you can gently massage between your fingers, and you'll see that as long as you're in that subcutaneous plane, you're going to be able to move the filler from one end to the next.
Right. Which is why it's so important to choose the right filler, especially if you are going to do a bolus method. Like Michelle said, it is quite comfortable of a procedure. There are a few moments that are a little bit spicy for the patients. The product also has lidocaine in it, so they will feel a little bit numb as we're injecting. You can see in the video as well for our entry point, we did also numb that area with a little bit of lidocaine with epinephrine. So that's what that blanching area is, which also makes it a little bit easier for you to mark where you want your entry point because we can visually see it. So the initial poke is less painful for patients as well.
Yeah. And how long does filler last in the hands?
So it depends on the person and which product we're using, also the volume of product. But I would say people usually get about like 9 months to a year out of filler in the hands. Again, depending on which goal is for them. They may want to refill sooner than that. It's all dependent on the patient. And if you're taking care of your hands, so if you're using that SPF, that retinol after getting the filler, you're going to get much longer results if we're preventing any further damage to the hands.
One thing I want to mention, and we'll cover this in a later video, is the use of biostimulators in the hands. So the ones that we have available to us are Sculptra and Radiesse, and those are beautiful products to use in the hands. We'll be covering it a little bit later. The technique is actually very similar. It's the same technique. It's just the composition of the product that's a little bit different. And yeah, we'll be chatting about that, but to not forget about biostimulators in the hands, because results can be very beautiful and regenerative.
Right. And with the biostimulators, that's kind of, like Michelle said, more of the regenerative aspect. So those are the results that you're not going to necessarily see as much of immediately as you would with a hyaluronic acid filler. But those are things that help your body produce more collagen, elastin over time. So you will gradually see an improvement 3, 6, 9 months down the road that will continue 2+ years. So those are things to consider as well. What your end goal is, what your immediate goal is, it kind of helps us determine which product is best for you.
Yeah. Feel free to leave us any questions below, and we'll be sure to address them, and we'll see you next week.
Thanks so much. See you guys.